All right, welcome to the Personnel Committee on May 30th, 2018. I'm your Chairman, Mark Grimm. One of the things I'd like to do to start each session is to call the roll, so for anybody watching, they know who all the members are, if that'd be okay. Mr. Ward?
Present.
Mr. Touche?
Here.
Mr. Joyce?
Here.
Ms. McLean Lane?
Here.
Ms. McKnight? Ms. Lakakis?
Yes,
Okay.
present.
Present,
Accounted
okay.
for. Sorry, I thought it on 6:15.
Mr. O'Brien?
On my
Here.
mind.
And Mr. Stevens?
Here.
Okay. First order of business is minutes. Has everyone had an opportunity to review the minutes from the previous meeting? Is there a motion?
So moved.
Mr. Touche, second by Ms. McLean Lane. All those in favor?
Aye.
Opposed? Unanimous? First order of business, Resolution 131, public hearing on the proposed local law F, nepotism. Mr. Drake?
Thank you for having me.
Okay.
Mr. Chairman, we just received
Right, the county attorney's been in to pass
an
it around.
opinion from the county attorney dated May 30th, about 4:30 p.m., after a significant wait. And therefore, though I've had the opportunity to review it, I haven't had the opportunity to respond or make any sort of amendments that might otherwise be appropriate, given the circumstances. So to that end, I would like to, entertain any questions. I'm not sure that anybody else has had the opportunity to read this.
Has anybody else had an opportunity to review the opinion from the county attorney? It came late
I have
today.
my own version. Or actually, you know what? I might take that.
Would anyone like to make a motion to table it, given the lateness of the...
Oh, he can sponsor it.
I'll make a motion to table.
Mr. Stevens?
Yeah.
Seconded by Mr. O'Brien. All those in favor of tabling it? Opposed? Unanimous.
We'll be back. Thank you.
Same thing for item 2 is actually the resolution.
Make motion.
Mr. Stevens, the motion, Mr. O'Brien, the second. All in favor?
Aye.
Opposed? Unanimous? Third item, confirming the appointment of the Director of the Department of Residential Health Care Facilities. Any discussion?
Here.
Okay.
Mr. Chair, would you like Mr. Slack to come up and
Yeah, sure.
any questions?
Yeah. Mr. Larry Slatsky, who's the Director of the nursing home, do you have any questions regarding your contract?
I don't.
Okay. Do any members? Yes. Ms. Lakakis.
Here's a difficult question. What is, you thinking about a succession plan? Is there anything in the is there anything, like if something should befall you, is there a backup sort of a plan? Are you keeping anybody under your wing? Things like that. I know it's a dance that you're doing, and I appreciate it. You do really good work, so don't take it personally.
You're a good dancer.
And the answer is that clearly, as we get towards the end of this agreement, that has to be in some way put in place. That the assumption has to be that there needs to be a transition plan, a succession plan, call it what you will. Right now, I'm focused, as we all are, on the renovation, but clearly that would need to be put in place.
Okay, thank you.
Any other questions? Let me say, Mr. Slatky, it would be hard to imagine someone who has had a greater impact on the finances of this county than you have over these past several years, given where we were in running in the red in the nursing home. And what you've done is nothing short of remarkable, and I thank you.
Well, thank you so much.
Any questions? Motion to approve the contract? Mr. Ward, second by Mr. O'Brien. All those in favor?
Aye.
Opposed? Unanimous, and congratulations.
Thank you so much. Very much appreciated.
Keep up the good work.
Item 4, Resolution 231, requiring the Department of Human Resources initiate a pay equity study for all employees. Is the sponsor here?
Not Sam.
Not here? Okay. All right, we table it, then the sponsor's not here to address it, okay. Item 5, Resolution 230, go.
I'm so sorry, Brandon, could you please add me to that?
Okay,
Sorry.
yeah, that's fine. Resolution 235, establishing a municipal cooperative health benefit plan to address rising healthcare costs. Mr. Scarlatti,
Yes, sir.
could you address this, please, fine gentleman?
I will, looking to move this out to end up creating a committee, so if there's any questions, I will answer them to the best of my ability.
Questions? Yes, Mr. Ward.
Well, you and I talked about this.
Yes, sir.
There already is another committee out there that's looking at this. That county committee, it's not a legislative committee, but it's a municipal committee. I don't know if this would supersede that committee, or are we going to have
Well, as of, to go through, there's 3 people until it gets established. Myself, the controller, and the county executive are the 3 individuals to wind up, once it's created, to wind up moving forward, and then it has a breakdown of who is on unions, municipal leaders, and as well as appointments from this honorable legislative body that may or may not include me or any other member, one from the minority, one from the majority, and one from the chairman. So the legislative side will be represented, as well as the controller, the county executive. So it's something that in shared services, that it's a legislative initiative that I'm putting forth, and I want to make sure that the legislature has a seat at the table. So I'm respectfully asking this honorable committee to wind up putting this out with a favorable recommendation for the full body to vote on.
I'll make the motion.
Okay, can you, just for
Yes,
viewers,
sir.
in a nutshell, what is you're hoping to accomplish with this?
Well, this, currently, every locality within Albany County, all 19 of them, villages, towns, cities, all have health care that they give to their employees. Rising healthcare costs in each of the municipalities wind up having, an adverse effect on the budgets. Having a larger group where individuals could wind up buying in, having larger share, lower costs, it would wind up being a cost-saving measures that we could wind up actually passing on to the residents that we represent on a tax purpose, on a local tax, if that they're able to wind up getting a cheaper rate for their on their health insurance. So it's trying to not only create something in Albany County, but having buy-ins for other areas, other counties, school districts, things along that line that everybody can wind up benefiting from. And we all represent, individuals, so it's trying to save a dollar here and there.
It's along the lines of the shared services, just
Correct, it is
another
a
way
shared
of
service.
working cooperatively to the benefit of everyone involved in the consortium.
Correct, and currently there's a law in the book more or less stipulating that smaller towns, if you have less than 50 employees, are not able to wind up purchasing or coming on to Albany County's self-insured plan, where they would have a great deal of savings. And this kind of opens it up through Article 47 that we're able to wind up putting this cooperative together, and not only doing it within Albany County, but we can wind up working with adjoining counties. And it's something that the governor is promoting, and who knows if there's money that's out there, or if the state legislature approves money for this type of consortium. I know that there are several legislators in the area that are well versed in this and are supporters of this initiative. So I'm just asking that the legislature puts forth the resolution so that the legislative body can wind up having a seat at the table.
Ms. McLean Lane.
So thank you for bringing this forward. I do think this is a good idea. The one question I do have is the municipalities within Albany County that are currently self-insured, of course excluding the county, like the town of Colony and some various larger municipalities that have the financial ability to self-insure. Would they want to come over? Because if we're joining, would everybody stay within their own, experience rating or community rating that they have now? Or would they all end up moving to community rating being cooperative? I think that would be my one
That's
concern, I
a
guess, but
question,
that's a question we can
an underwriting
come
question
to.
that I unfortunately I don't have
Sure.
that information, but I know that in the conversations that I had while I was putting this together, Colony came up and Albany came up. It may not be conducive for some of the larger cities or towns to wind up participating. In the end, they could, if they wind up seeing that our rates are cheaper than theirs, and everybody would wind up having buy-in. And this is kind of setting up the structure and seeing what the cost is, if there is any cost. Whether it's a 2-year, 3-year, 4-year, who sees the immediate results, who doesn't see immediate results. So it's more or less kind of putting it forth and getting the ball rolling.
Mr. Ward, I'm sorry.
I was just going to comment, I'm sorry,
Yep.
Chairman, that I do see the benefit for the smaller municipalities, absolutely. I think it's a great idea, I really do.
Mr. Ward, you had a question?
No, I do see the benefit of the legislature being at the table on the committee, but it would be nice if we can get together and get the two committees as one.
Absolutely.
With the legislature at the table.
Once we get it established, there's 3 individuals that are on there to wind up moving the ball forward.
Ms. Cunningham?
Yeah, I'm a co-sponsor of it because I thought, as soon as Ralph threw it out there as an idea, it's a really, really interesting idea. I've done a little bit of reading on it. There is at least one county in the state that has gone this route. I noticed the county exec's announcement after this was introduced, and I think there's a good opportunity for collaborative work on this. The idea is you take a larger risk pool and rates go down because your risk is spread across not just the county employee structure, but potentially municipalities all across Albany County. It's a really, really interesting idea. I think there could be a huge potential for opportunity here for better rates, for much better negotiations with plans, for optimizing benefit structure. It's a great idea.
Mr. Bergdorf?
I too, when Ralph threw it out, asked to be a co-sponsor. I'm not sure if I was listed or not, but I would like to be.
So noted.
But I have a question. We're paying the Rockefeller Institute $100,000 to implement the shared services plan, for which this was the #1 priority. How are we going to staff this commission to assist the legislature? Is it going to be from legislative staff, county executive staff, Rockefeller Institute staff? Because I'm of the impression that we need to have various types of state legislation to implement some of the intricacies of being able to go back and forth against different types of insured entities that are involved in the county. So how are we going to staff it, and do we plan to, since the county executive's involved, and the county executive is driving the Rockefeller staff, how's that going to work together?
Well, once we get the ball rolling, from my vantage point, we do have 3 legislators that will wind up being on the committee. So there is legislative staff from not only the minority caucus, but from the majority caucus, and as well as the chairman. And, the one thing that I did not include, because it wasn't until afterwards, the minority caucus, so I don't want to think that I excluded anybody from the minority caucus on this. But we would wind up having various staffing that we could wind up pulling together from legislative staff as well as the legislators that are on it, once we get the ball rolling and get the legislature with the seat at the table.
Is it possible to ask Mr. McLaughlin just to give us an update on what Rockefeller's doing in this regard?
Is that okay, Mr. Chair?
Sure, absolutely.
So we've been working on this initiative for several months, basically since we released our report. Dr. Jenna in my office has been working on this issue. We have the health insurance information from probably about, we're at about a dozen municipalities right now. And some state changes have been made, which allows municipalities below 50 to engage in these conversations, which obviously increases the number of individuals individual municipalities that can be involved. We're very aware of the Tompkins County example. That's the primary model that we're following. Rockefeller Institute, and specifically Tom Citrino, for those of you who know him. He's part of the team. He's actually from SUNY New Paltz, but he is the primary individual working with Bakri in our office to do this, and we have been progressing as quickly as we can. Some municipalities have been more responsive than others, but so that's kind of where we're at. It's built into their contract. It's the largest possible savings that we can achieve if we are able to achieve it. It's also probably the most difficult item that's in the plan, but that's kind of where we're at.
Okay. Any further discussion? Yes, Mr. Joyce.
I'd like to be added, and also I'll second Mr. Ward's motion.
Okay.
I'd like to be added as well.
Touche.
Yep.
Bergdorf.
Bergdorf also.
Ward. O'Brien.
Paying quick rim on there too.
Oh, you go.
Feeney times me. Okay, any further discussion? Okay, Mr. Sidranchi, thank you very much.
Where is it?
Motion, yeah, motion. We had one,
We had a motion.
was the Ward?
There's a motion.
In a second.
Second by Joyce, yeah. Okay, all in favor?
Aye.
Opposed? Unanimous.
Thank you.
Okay, thank you. Any further discussion? No. Motion for adjournment? Mr. O'Brien, Ms. McLean is second. All in favor?
Aye.
Opposed? Unanimous, thank you.